this is a misconception that a lot of people have, that yeah, my pressure is high when I have headaches, or when I have chest pain, and when I feel dizzy, or my sugars will be high. I know when my sugars are high because I'll be peeing a lot, or I'll feel dizzy. That is not true.
Okay.
Okay. A lot of times you can be walking around with a blood pressure of 180 or 100, which is very high, and yet you have no symptoms.
Okay.
Okay.
How is that? Yeah.
You can be having blood sugars of up to 20 millimoles per liter, and you're not having any symptoms. Okay. So people take the medications erratically because they're like, oh, my pressure is not high today, so I will not take the medications. Oh, my sugar is not high today, so I will not take my medications. The only way you can know when your blood pressure and your blood sugar is high is if you check. Okay. And you cannot stop the medications for whatever reason.
Yeah.
This is why diabetes and high blood pressure are called the two silent killers, because they don't cause the overt symptoms, but yet they're causing damage within the body. Okay. And over time, the damage becomes irreversible, meaning that you cannot reverse that damage. So those are the two most common causes of kidney disease. We also have infections that can cause kidney disease, like HIV. Okay. We can have inflammations like glomerulonephritis, which can cause kidney disease. And of course, there are some genetic causes like polycystic kidney disease, which run in families, which can also cause kidney disease as well.
Yeah. Can you talk about that, like the lifestyle, or the things that we do that again might expose us to a case of kidney disease? I mean, diabetes and high blood pressure, of course, that one is one of them, but some of the other things that we do that might predispose us to kidney disease.
A sedentary lifestyle, which predisposes you to obesity, eating the wrong foods, which again predisposes you to obesity. And obesity is now becoming one of the common causes of kidney disease as well. Okay. Smoking. Smoking doesn't directly cause kidney disease, but what smoking does is that if you have chronic kidney disease, it accelerates the progression of chronic kidney disease to end-stage kidney disease as well. The other things as well that we tend to do, like taking over-the-counter medications. You have a cough, you have a cold, you have a headache, you go to the pharmacy gives you non-steroidal anti-inflammatory drugs, or commonly NSAIDs like Brufen, diclofenac, Maramoja, headaches. These drugs basically contain NSAIDs, which have been shown to cause kidney disease and kidney damage. And if you take them consistently all the time, it will lead to kidney failure as well. The other important thing that people tend to do, which I always advise them not to do, is to take herbal medicines. Herbal medicines as well, because we don't know what the ingredients are in those herbal medicines. Some people are predisposed to getting kidney damage with those ingredients. They get what is called interstitial nephritis. Okay. So we need to avoid those kinds of behaviors. I mean, if you're not feeling well, please come and see your doctor. Okay. It is not good to go to the pharmacy, and the pharmacist also is not supposed to give you medications, because they are not doctors. They are just supposed to advise you on the prescriptions that are given by the doctors. Yes.
And I'm happy that you're calling people out, which I think is something that we need, because we do that a lot of the time.
Yes.
There's pain here, the first thing you reach out for is, a simple painkiller. But like you said, consistent use of some of these painkillers might predispose you to, again, a case of kidney disease. Can you talk about then like the different, I know there are like a majority of like kidney diseases, which again, we do not have time to talk about all of them, but some of the major, kidney diseases that we experience, and of course, touching on the acute and the chronic types.
So, I mean, that's a very vast discussion topic about the kidney diseases.
Yeah.
You can talk about acute kidney disease and chronic kidney disease. So when you talk about acute kidney disease, it means that somebody who does not have kidney disease previously, because of an event that happened, like an infection like malaria, or they developed diarrhea and vomiting, or they were involved in an accident and lost a lot of blood. Because of that, the kidneys get damaged, and they develop what is called acute kidney injury, as it's correctly called.
Yeah.
Now, the good thing with that is that most of the times, if you pick it up if you diagnose it on time, it is reversible, because you will correct whatever is causing the kidney disease or the kidney damage. Okay. Even if somebody somebody's kidneys become normal after getting an episode of acute kidney injury, it is important to note that they are predisposed to getting chronic kidney disease later on in life. Okay? Because whatever damage has been done, remember that it is the other parts of the kidney that are not damaged that take over the function. So your reserve has gone down.
Yeah.
So you have to be extra careful. Okay? Now, chronic kidney disease basically is defined as kidney disease that has been there for more than 3 months. Okay? That's a time period that we have. And normally it is caused by the chronic diseases that we talked about: diabetes, high blood pressure, obesity, the genetic causes like polycystic kidney disease. Okay? Now, when somebody has chronic kidney disease, there are different stages of chronic kidney disease. There's stage 1, stage 2, up to stage 5. Stage 5 is what is called end-stage kidney disease, meaning that now the kidney has reached a point whereby it is not able to maintain or sustain the normal functions, which is supposed to help to keep the body healthy. Okay? So what our job is, one is to prevent the patients from developing chronic kidney disease, and if they do develop chronic kidney disease, it is to basically prevent or delay the progression to end-stage kidney disease.